Isn't this the most amazing conference? I think we're all really learning a lot. Congratulations to everyone that created this and that's here. There are a lot of things people can do on a weekend, but being here is really important. Okay, I think we're gonna start now. So I'd like to introduce to you 5 individuals who are creating and successfully implementing policies and programs that are making a real difference in their communities. And I'm going to introduce them. They're 5 wonderful speakers, and I'm going to introduce them in the order they'll be speaking. And then at the very end, if there's some questions, we'd love to hear from you, and they'd love to be able to interact with you more closely. So, our first speaker is Megan Dunn. She's the People and Communities Program Director for the Northwest Center for Alternatives to Pesticides. Her graduate environmental policy research work included creating an index of human well-being as part of an integrated ecosystem assessment, IEA, with the National Oceanographic and Atmospheric Administration from NOAA. I know it more like that. And she lives and works in Everett, Washington, and will continue her efforts on behalf of NCAP. Our second speaker is Matt Wallach, and he's the project director for the Integrated Pest Management Program in Healthcare Facilities Project. It's a partnership of the Maryland Pesticide Network and Beyond Pesticides. And Mr. Wallach has a long-standing commitment to public education and activism and has an environmental health and safety issues. He previously worked as the program coordinator for Citizens Campaign for the Environment in New York State, where he worked on local, state, and regional campaigns to reduce pesticide use, conserve open space, and ensure a clean water supply. And our third speaker, we've heard from her earlier, is the remarkable Rella Abernathy. She's the Integrated Pest Management. Yes, please, she deserves that applause. She really does. They all do, but especially Rella right now, is the Integrated Pest Management Coordinator for the city of Boulder, Colorado. Boulder, as you've heard, was one of the first cities to adopt an IPM policy and neighbor notification ordinance for pesticide applications. Boulder has nearly 100 urban parks and over 47,000 acres of open land. The city's reduced pesticide use substantially since the adoption of its first IPM policy in 1993, with the goal of reduction and elimination of pesticides use whenever possible. Rella became the IPM coordinator for the city of Boulder in 2009, and her background is in entomology, and she worked at EPA's pesticide program on sustainable agriculture and pesticide reduction. Our fourth speaker is also Mr. John Wild. He's the housing inspector of the Housing and Community Service Agency of Lane County, where he implements least toxic bed control techniques in public housing to reduce pesticide use. Such techniques include the use of heat and cold probes that shock bed bugs with temperature extremes, room heating to prevent importing bed bugs on incoming furniture and personal items, and the use of least toxic cedar oil products that he says stops bugs on contact. Mr. Wild received the NCAP Rachel Carson Award in 2011 for his commendable work. And our last speaker is Kevin Finney. He's the Park Operations Manager for the city of Eugene, and we heard about his remarkable work a little bit earlier. He leads the team which maintains over 60 developed parks, and he was instrumental in the creation of the city's pesticide-free parks program and the development of Eugene's integrated pest management policy and operation manual, and he recently headed the staff team that developed Eugene's resolution banning the use of the neonicotinoids on city property. Kevin has degrees from UC Santa Barbara and the University of Oregon, and he's worked in public land management in Alaska, Oregon, and the Republic of Marshall Islands. Neonics is what I intended to say, sorry. So they're all going to, the first three speakers will be doing presentations, and then the other individuals will be adding to the presentations they did earlier. So there'll be plenty of time for questions. So thank you so much.
Move it up. Hi, my name is Megan Dunn. I'm the People and Communities Program Director with NCAP, Northwest Center for Alternatives to Pesticides. Today I'm going to talk about why, how, and who for pesticides, schools, and children. A quick overview is I'm going to start with why, talk about specifics related to pesticides and children. What is IPM? Why is IPM important? Oregon's school IPM law and IPM and pesticide reduction in schools or in your school. So whenever I'm talking with someone or trying to convince someone to create an IPM or to reduce pesticides, it's important to start with why. And there's a really great TED Talk called Start With Why that talks about why you can't get to the how and the what until you convince people why. So if I'm talking to a policymaker, I'm going to say that they're obligated to protect human health. Doctors have to protect and monitor children's health. And when I talk to people at parks, I say people want safe and clean drinking water, and that we need to protect the waters of Puget Sound or the Salish Sea or Willamette Valley, or insert your local wildlife area here. So you have to start with why. Next is, why are pesticides concerning? So we know that they're engineered to be toxic, that they're not always thoroughly tested. There's over 60,000 different chemicals, and the EPA and our policy can't keep up with all those different chemicals. So they're not always thoroughly tested. They're put out on the market and sprayed on our plants without being checked. They're linked to serious illnesses, they're linked to lower test scores, and they're linked to poor indoor air quality, which is a problem for schools where you have kids with asthma. They also create water quality issues, and they don't actually solve pest problems. So children and pesticides. Children or kids are more affected by toxic exposure, and kids are more likely to become exposed. So I have two slides to support those two statements. And this is the American Academy of Pediatrics policy statement that we heard this morning. And having this policy statement has been just so essential for advocacy organizations like ours, because to have that reputable organization to say that there's there's evidence that demonstrates association between early life exposure to pesticides and pediatric cancers, decreased cognitive function, and behavioral problems. So to have that organization put out that policy statement and say, we recommend IPM for use in schools and anywhere there's children, that's been integral for us. This is a second statement from the U.S. Environmental Protection Agency that explains why children are at greater risk, because they have different metabolic rates, their immune systems provide less natural protection, they're also closer to the ground, they're putting things in their mouth, so children are especially susceptible to chemical exposure and to pesticides. So how do we make a difference? Integrated pest management is one way, and I'll be talking about schools, and we've also heard about an IPM in public spaces and housing. So how do you get an IPM in your city or with your parks or in your school? We've seen the best response when we work with a coalition made up of stakeholders, advocates, and policymakers, or the politicians who are going to make the final decision. It's important to have compelling stories for decision makers. You need to use best practices and proven solutions, scientifically proven solutions. Use pilot programs and compare with other states. I'm sure Eugene probably had a couple parks that they started with at first, and then you move on and replicate that model. So you also have tools to replicate your success, and then after you have your policy implemented, it's important to watchdog. So with a coalition of groups, we got the Oregon schools to have an IPM policy, and now we're watchdogging that policy. We're making sure every anniversary of the implementation. We find out how many schools are involved, we find out how many complaints have been made, we evaluate and monitor, and we make sure that that coalition stays active so that if there's any attacks on the law or if they try to weaken it or remove it, we're still there and we're involved. And this is, my friend Patrick Rainsborough used to say, and I'm not sure if he said this or I'm not sure who to give credit for this quote, but he said, if you're one person standing there with a sign, you're crazy. But if you have your friend with you, then you're a movement. So if you can just find at least one friend, to hold another sign with you, then you can be a movement and you can make a difference. But one person, you might come off as a little crazy at first. This is a slide from the University of Nevada. This is the basis of our IPM protocol. So the basis is prevention. You need to see weeds and pests as a symptom of something. So if you have mice, you have food sitting out somewhere, or you have your dumpsters too close to your entrance and exit. So you can, if you move a dumpster at least 20 feet away from a door, you can decrease the number of mice by 80% in your school. So we look at prevention and we look at weeds as a sign of something else. You have dandelions, it means you might have an aeration problem and you need to try these other alternatives before you spray. So the last step would be a chemical pesticide, and hopefully that's avoided at all costs. So we have cultural sanitation, physical, mechanical, biological, and then as a last resort would be chemical. Because if you talk to the Parks Department, and to replace an athletic field of roughly 8 acres would probably cost about $200,000. And so we don't want blackberries to take over playground equipment or crabgrass to take over a field. So there is that action component in an IPM. So time to go to school. I don't recommend this. Do not throw paper airplanes in school. So Oregon's IPM law became effective July 1st, 2012, and it says that every school, every private, public K-12 school, and some daycares, which are Head Start programs, must have IPM plans. Only low-impact pesticides can be used. Pesticides are a last resort. Only licensed professionals can use pesticides, and you must notify the parents if pesticides are applied, and you must keep records if pesticides are applied. We have certain signal words, so caution would be low toxicity, a warning is moderate toxicity, and danger is high. And in that law, we were able to keep this in, that if it has danger on the warning label, then then it would not be allowed to be used in Oregon schools. So if anyone in this room can get Roundup to be labeled as danger, then we would all be a lot safer, or the kids in Oregon schools would. So in addition to the laws, and also in the Oregon schools law, the IPM coordinators must receive at least 6 hours of training. They must conduct education and outreach to school staff. They oversee pest prevention efforts, ensure that the IPM plan is followed. They have to, it assures notification, posting, record keeping, and applications. It maintains an approved pesticide list and responds to school staff and parents about noncompliance. And an IPM coordinator can be responsible for more than one school. So NCAP and OSU, the Oregon State University, worked with schools to ask the question after the law was passed. It was passed in 2009 and then went into effect in 2012, is how does your school practice IPM and what could be improved? So this gave us a wonderful opportunity to outreach to all the schools and actually walk through them all with a checklist, and we would see where's the dumpster, do you clean out your drains? These are all different ways to prevent pesticide use. So these are some common things we may find. So this teacher's lounge is going to have some ants if they don't clean off the top of their microwave, if they don't empty out the garbage, and boxes everywhere. It's a lot about just sanitation and cleanliness. Also caulking or sealing open spaces and doors. Anytime branches are touching trees, so we go through with experts and we go through with us facility managers and make sure that they're doing all their steps necessary to prevent. So who is going to expand IPMs to public spaces and to other schools and to municipalities? Well, so our government, is the mayor and the city council. They're probably not going to want to give themselves any extra work and do it, with the exception of Colorado. If you don't have someone who really wants to push it, right, municipalities are not going to do it. Corporations, Roundup or Monsanto is not going to say, oops, we were wrong, like, it does cause cancer, we're sorry. So they're not going to change their ways. Principals and teachers are very busy. They have testing, they have test scores to worry about. So that really just leaves us, and now me, because I just got hired a month ago to expand IPM into Washington. So it leaves all of us in this room and all of your friends. So that's one is a crazy person, one more would be a movement. So everyone has to get their friends involved and use some guilt, and it works. So we have a lot of IPM resources on our website. We were just talking about the City of Davis. So NCAP has fact sheets and a toolkit. We have model IPM policies where you can just insert the language and create your own policy. I would send the City of Eugene's policy out to any parks department and say, this is a model policy to include. The EPA has fact sheets on pesticides and why it's important to avoid pesticides. OSU School IPM Education Program has a number of materials. Seeing if anybody else is writing. We have other IPM resources. We have videos on YouTube, and then which you can get to from our site. Also on bed bugs and information on mice for schools. So this is my contact information if anybody wants to contact me. And I want to thank Josh, who's not here, for helping me with the slides. Thank you.
All right. Hi, everyone. I'm Matt Wallach. I'm the project director for the IPM and Healthcare Facilities Project, which was mentioned as a joint project between Beyond Pesticides and Maryland Pesticide Network. And our goal, obviously, is to work with hospitals to get rid of, eliminate the use of pesticides. And so the mission is to protect the health of vulnerable patients and staff from the dangers of toxic pesticides through toxic-free pest management that promotes healthy indoor and outdoor environments. And why look at hospital pest management practices? The goal, obviously, is to protect the people that are most vulnerable and most risk to the effects of pesticides. These are the elderly, these are infants, these are people that are suffering from diseases or recovering from diseases. But also, since this topic is on policy, hospitals are also community leaders. A lot of people attend hospitals not just to get well, but also for events. Hospitals also can influence a city or a town. They're also they hire usually a large employer in a town or a city, and having them do the right thing and set an example of toxic-free pest management can be critical and definitely influence the areas beyond just their walls. So obviously, I mentioned some of these are the most vulnerable populations that usually are found within a hospital, and it would be silly for someone suffering from an asthma attack to go to a hospital and be exposed to chemicals that can make an asthma attack worse. And this is a picture that a lot of people have seen, and some of these things we talked about earlier in this conference. But these are some of the reasons why people go to hospitals, and these have all skyrocketed. So when a facility looks at what they should be using to treat a pest issue, whether it's an insect or a rodent, not allowing chemicals that can make these problems worse should be their priority. Since this project has started, we work with about a dozen healthcare facilities. Some of them are included in several medical systems throughout Maryland. And we were able to award in the last 4 years hospitals for practicing such a high level of integrated pest management that they are completely pesticide free for managing pests. And that is, I feel it's a trend that's going to grow. I would say the goal is to make this project so successful that I become unnecessary. And once hospitals are practicing a high level of IPM, then pesticides will become unnecessary, and they're able to show that example off beyond their walls. So the main thing with hospitals, and this is some of the things that were talked about earlier in this, is that conventional pest control ignores the causes of pest infestation. And the goal of actually making this change is getting the people at the healthcare facility to understand the root causes of why they have certain pests, whether common ones, which I'll mention in a little bit, are, coming up soon, are ants, roaches, flies, and mice, and other rodents. And understanding how these pests enter the facility and how they exist and thrive in the facility is the #1 way to solving the problem. And there's about 37 commonly used pesticides found in the healthcare industry, and many are linked to birth defects or cancers, or definitely negatively affect the environment. These are the common ones that I have found. Depending on where a healthcare facility is, they might be more susceptible to different types of pests. But these are the common ones that have been found. Bed bugs are very prominent in the ER. Fruit flies are very common in trash rooms or kitchens. Roaches are obviously found in kitchens or receiving areas. Ants, usually anywhere where they have access to the outside. And mice usually enter right through the front door or back door if there's no door sweep, or if the doors are left open, or if there's a large enough crack for them to fit through. Not going to cover all this. Obviously, pests are major issues within healthcare facilities because they can be asthmagens themselves. They can transmit disease. They're dirty, and that's the last thing you want to find in a healthcare facility. So understanding, again, that a high level of integrated pest management not only just gets rid of pests without exposing people to toxins, but it does a better job in removing the pest, which could again transmit disease, create dirty conditions, or and are obviously unsightly for guests or patients at the facility. It's understanding that IPM is a strategy focusing on long-term prevention and suppression of pest problems, and least hazardous pesticides, according to our definition of IPM, are a last resort for healthcare facilities. Toxic pesticides would not need to be used, and least toxics are never used as a prevention measure. So the facilities that have won our award in the past, facilities that are practicing a high level of IPM, are using least toxics as a last resort, and like I said, putting a focus on prevention. And these are some quotes. The American Medical Association has agreed that using pesticides for healthcare facilities are dangerous choice. Department of Veteran Affairs, as far back as 1986, the underlying part requires that a cautious policy be adopted concerning all uses of pesticides. And that came up a little later. And one of the reasons why, again, we started this project within healthcare facilities is based on a survey of Maryland healthcare facilities, and 45% of them recognize that their pest management program should reduce the reliance on pesticides by addressing the root causes of pest infestation. And many understood what they need to do, but really didn't take that in action. Also in that survey, it revealed a large quantity of pesticides being used, and so that many understood that they did need a change, but weren't prepared to take that next step and realize what they need to do to start the process of prevention of pests. So what we offer the facility is an understanding of what they need to do, whether it's increased monitoring and inspections and staff education. Staff education is critical. There's a large number of staff within a healthcare facility, and everyone needs to understand their own role of how they cause potential pest pressures and what they can do to stop the pest, rather than just relying on a pest control technician to solve the problem. So the very simplest thing is inspect, detect, correct, and when staff understands how to eliminate food and restrict entry and control habitat through those steps there, it definitely reduces the presence of pests and the food that attracts them into the facility, as well as their entry points. And then, this is mentioned earlier, least toxics are used as a last resort. These are a list of some of the least toxics that we recommend for healthcare facilities. Boric acids are very common because they do not volatile and do not gas off. These other ones are used for a variety of different pests. These are examples of it working and of IPM working. Obviously, the other people on the panel have all pointed to their own success with IPM. And earlier on, we kind of used these stats kind of to start off the project. But like I said, in the last 4 years, we've had 4 hospitals go completely pesticide-free with this project also. So what we offer, we do walkthroughs with an IPM team. And identifying an IPM team, it's usually part of the environmental services, which is housekeeping, it's facilities and maintenance, sometimes administration. It's also food services, as well as the technician, the pest control technician in the company that is charged with managing pests. We assist with IPM plan review, review reports, make recommendations. We do ongoing reviews of the pest management logs. We help develop an IPM policy and plans. And we really assist, the main thing with the educational aspect of things, making sure that everyone's on the same page. Here's an example. One of the healthcare facilities, this is an excerpt of their policy that we helped with. LifeBridge Health's pest management policy is integrated pest management that prevents and responds to pest problems with strategies and methods that pose the least possible hazard to people, property, and the environment. At LifeBridge Health, least toxic pesticides are only used as a last resort after non-toxic options for resolving pest problems have been exhausted or are deemed unreasonable, and that's from their policy. So these are some of the things we look for. I mentioned some of these areas where pests are common. And a lot of times, it's not always a lack of cleaning, but it's a lack of understanding what is causing the pest. So sometimes, these are just some pictures that that we have, but sometimes drains are cleaned, but the lip of the drain is not cleaned. Or trash is pulled, but the area behind that trash can is not pulled or not cleaned. And so whereas cleaning is occurring, there's areas that are being missed and pose a large attractants to pests. These are all different things. You can see the gaps around the plumbing, excessive cardboard, which creates a harborage for roaches. There's an exterior door that needs a door sweep. Obviously, crumbs and clutter create access for ants. And again, these are just other examples of areas that sometimes are cleaned or missed during the process where understanding how IPM in a healthcare facility prevents these type of issues. Again, some areas that could be, I just want to point out one of them in the lower left is a monitor for roaches right above a crack where roaches are probably coming out of. A little caulk would solve that problem right there. And that is in the kitchen, so it's always very moist and organic material could get in that crack. This is an area of one of the facilities that has generally been treated on an annual basis for ants because they easily enter the building through cracks and crevices around those windows. So we're working with the hospital to cut back some of those bushes, find the entry points for the ants, and when inside, really working to identify where the ants are feeding and eliminate the food, whether it's providing sealed containers for residents' food, or not allowing food to be eaten in offices or stored in offices, prevent the attractants that ants enter, why they enter. Again, fruit flies are very common. One of the things we always recommend is not to have these type of tile floors. This is an example of a leak. Using fans, having proper venting and exhaust prevents excessive water from building up, which would decrease roach populations and fruit fly and drain fly populations. Exterior, this is already mentioned, where removing trash, cleaning trash cans, making sure doors are closed and have door sweeps, prevent access to for mice and other rodents to enter a facility. Exclusion, sanitation, inspection, those are the highlights there. And let's go through that one. The IPM coordination position at a facility, the coordinator ensures that communication and proper everyone knows their role between environmental services, food services, maintenance, vendors, pest management technicians. We found that the hospitals or the facilities that have the best coordinators also see the most progress. Having that position of IPM coordinator is crucial to making a change at the facility. And they also would be working with me for advancing education within the facility. So like I said, before and after is always key, where I say most of it's the understanding, where all staff understand their role of what, if they're causing a pest pressure or if they're reducing a pest pressure. If there's an issue, are they waiting for a pest control company to come in and deal with it? Or are they calling a maintenance to ask them to seal up a crack or crevice? And then once the whole facility is working as a whole, what kind of influence can they make on their own staff, on their residents? They could advertise the fact that it's a toxic-free facility, promote the fact that, and tell their residents what they are doing to reduce pests and without using anything toxic, and share that with the rest of the community. That's an example of a technician's log of it's not really marked, but it shows that what areas they travel to. They'll mark off, if there's an issue, they'll mark off the sanitation conditions and recommendations. And all I do is I review these and make a spreadsheet so a hospital will know what areas they need to focus on. So we look at locations, recommendations. You can see some of the things have been recommended many times. And so whereas sometimes we could always point blame at the pest control company, say, hey, why are they using toxic pesticides to treat a problem? But when sometimes it's the hospital's fault for not following the recommendations by the pest control company. And it's kind of where I come in and really put the pressure on the facility to say, hey, if you have, if there's a recommendation to remove clutter, that will solve, which creates harborage for pests, it would allow for a better inspection and monitoring to solve that problem. So obviously ongoing efforts are necessary to change the culture of pest management in healthcare facilities so that everyone in the facility understands their role in preventing those conditions. Really, once a hospital and their staff and their patients understand what a facility is doing to reduce pests without anything toxic, then that information can be passed on, and I feel a community can really advance their IPM and prevent the use of anything toxic. Thank you.
My PowerPoint. I just wanted to give one really quick example of how you can take a mandatory law, a statutory requirement, and do something positive with it. So once again, I'm Rella Abernathy from the city of Boulder, the IPM coordinator. The state stat is a state law in Colorado that requires all municipalities to control a list of weeds, noxious weeds, that are considered A-list. And for those, and there's also some that are called B+, which means that in certain areas there's also mandatory requirement for eradication. And Boulder has some wonderful examples of things we've done on our own properties. But the law also requires municipalities to enforce that law on private property owners. And we kind of drug our feet for several years until they kind of upped the pressure. So in a situation like that, you know, when you're telling the public that they're going to have to control weeds, if they go to the state sites at either the universities, the land-grant universities, or the state, they're going to get recommendations for chemicals to use. And they, you know, in fairness, they, you know, have a lot of good information too, and tell people how they can remove them with other methods. But we figured people can get that information about chemicals, and we really didn't want to encourage people to use chemicals. So we decided, instead of passing out a lot of tickets, because the police department is the group who is in charge of enforcement for this, that we would, and it's a special group, the code enforcement group, that we would use a soft educational approach and really only talk about non-chemical methods. And so, you know, we always tell people, design a program, even within the statutory requirements that you have, you know, that fits the philosophy of your community. So I am in the planning department, and we also brought in all the expert staff from the other departments, you know, who had a lot of knowledge about plants. We're plant ecologists. And we worked with the police department. So instead of them going out and just giving out their own information, we worked together to put together information. But I think they look really nice. The police department code enforcement manager actually laid out the brochures with the information that, you know, the expert staff provided, and we all vetted it and checked it to make sure it was good advice to people. And so when we had to actually change our ordinance to require people to control, you know, these A-listed weeds on their properties. So we wanted to really use this as an opportunity to educate people about, you know, non-chemical methods and things that they could do to control weeds on their properties. And one of the reasons why, you know, we actually are supportive of this, because we all have to control these weeds on our own properties, is, you know, we have this extensive amount of open space. This is a weed that's illegal in Colorado. It's illegal in a few other places. I see it growing here as an ornamental. And most of the invasive weeds were originally ornamental plants. A lot of them are really beautiful plants. This is myrtle spurge. And big crews of people come in and hand pull the weed, and it costs the city a tremendous amount of money. Just one department spends about $10,000 a year just on hand control, and this is with volunteers too. And these plants get humongous. Well, not by your standards in Oregon, but by Colorado standards, these weeds get pretty big. But they're a good candidate for showing people non-chemical methods because you can hand pull them. And so at the time that we announced the ordinance change, we decided that we would try to make something fun where we give people something back in exchange, you know, for complying with the ordinance change. And so we did a lot of advertising. We did this Purge Your Spurge event that we stole from Denver, who stole from Utah, and I don't know where it originated. But the idea is you ask people to hand pull their weeds and bring them to you. And then when they bring them to you, you give them free plants in exchange. So we really work hard on getting, and we're doing it our second year in just a few weeks, really working hard on getting native plants, because the last thing we want to do is give people new plants that are going to become escaped ornamentals and start the treadmill again. And we're having a really hard time finding nursery plants that haven't been treated with neonics. When you start asking people, you start finding out. And, you know, and the vast majority of nurseries, even the nurseries that produce plants for restoration projects, natural restoration projects, all neonic treated. So we've really scrambled, and we've kind of got this mishmash of plants. You know, from some are gallons, some are little sleeves that are like, but, you know, we're just buying whatever we can buy that we know haven't been treated with neonics. And they're all native. Not all of them are exclusively native to the region. We want to have them native just to Boulder, the area around Boulder. So we're going to be meeting with a nursery who's really excited about providing native plants without neonics, and try to promote them and choose the plants that we're going to use next year. So let me show you how the Purge Spurge. We had so many people show up. We just had tons and tons of people. We collected 2.55 tons of myrtle spurge. And some people just brought like one little plant just to show they'd pulled it, you know. So we had that, and then we had whole trailer fulls of people. We had cars lined up. And, you know, the different departments help. These are Parks and Rec employees, seasonal employees helping here. And we used it as an opportunity to educate our open space staff. You know, there are they do research themselves, so they kind of are at the cutting edge, and they, you know, can provide information. So people bring a lot of other plants and say, what's this, or what should I put here? So they were able to provide information and educate people about native plants. And you know, we had just a constant stream of people. Unfortunately, myrtle spurge produces like a toxic sap. And this is the code enforcement manager right there from the police department unloading this truck, but these people showed up with like an open, you know, trailer filled with myrtle spurge, so she had to help unload it. But anyway, we're trying to take things that, you know, people might have, you know, concerns about, creating the wrong kind of message to people about invasives, and turn it around into something positive, because at least we can talk about the importance of growing plants that fit the space, and that's good for, you know, overall water conservation and management. So that's it. Thanks.
Perhaps I just have a few thoughts to tell you guys that I had left Home Forward, where I did all the IPM work, and really happy with the work that had been done. And now living in Eugene, started work about a month ago at HACSA, Housing and Community Service Association, and excited to start the dialogue to bring in some of the IPM practices that we followed in Portland down to Eugene. But one of the most fascinating buildings we have recently constructed in Portland is called the Bud Clark Commons, a 130-unit community for a population who had been chronically homeless, so homeless for over 2 years, and had significant health problems as well. Really a fascinating building that they agreed to put in a dry sauna, and the dry sauna was to be used as people move in, that their belongings are put into the sauna and heated up, I think they were saying 140 degrees effectively, so if they had any roaches or bed bugs in their possessions, they would roll them in, hang up clothes on racks and things, and talk about a totally green approach, you know, no pesticides, no toxics. Roughly a half hour later, they pull out the clothes, they launder them, then they move into their apartment. So it's been a great success, LEED Platinum building, and I look forward to working in Eugene and integrating an IPM plan there.
Why is that? Oh, I'm Kevin Finney, the Park Operations Manager from the City of Eugene again. Just a few thoughts to share with you about, I think I said earlier I would talk about how we got a ban on neonicotinoids passed in the City of Eugene. So interest in that. We started several years ago. There was pressure at the school district level, so school districts adopted IPM. As I mentioned, the City of Eugene had been doing IPM for about 30 years, and you know, you can do IPM many different ways, so we're doing it better and better all the time. We started our pesticide-free parks program. About a year ago, we went to council to report on the IPM program, and just about the time that the council started becoming aware of neonicotinoids, and it turned out that the folks who run our downtown hanging basket program had been applying neonicotinoids to those giant baskets covered with blooming flowers. So that, you can imagine, that got a lot of attention kind of quickly. That's exactly what we don't want to do. So folks from Beyond Toxics worked with council and staff, and we found one other place that we were using neonics. I would have said we weren't, but there they were. They were on the hanging baskets. They were also in the golf course. So we committed right away to to eliminate those applications, and that was about a year ago. Then about 2 months ago, a month ago, 6 weeks ago, I went back to council to report on progress, and also we'd been asked to prepare an ordinance to take all the parks pesticide free, which would be another 45 of them, take all the parks pesticide-free, adopt IPM across the city for all departments, because at this point it was just in the Parks Department, and also ban neonicotinoids. This was the resolution that went in front of council. They backed away from adopting the pesticide-free from turning all parks pesticide-free just because of the cost piece of it. So we're doing some looking at how we would implement that. We're having our budget struggles like everyone else. So they backed away from that, but they went forward with IPM, and I never would have put money on this. I never would have guessed this would happen. They voted unanimously to ban the application of neonicotinoid insecticides on city property. It just happened like that. And I think it had to do with sort of the climate that had been created in the community. The schools were using IPM. We had been using IPM. We've talked to them multiple times about it. The advocates were pushing them. The neighborhood groups were asking for more IPM approach, fewer applications of pesticides. So it was sort of a perfect storm for them, and it just happened so quickly. I will say I was astounded that the bar was so low, set so low across the nation that actually made news. I didn't realize that this was the first community that had adopted a ban on neonicotinoids. I thought the big news was we're going to expand our pesticide-free park program. But it literally was about 6 days later we caught from social media that was actually the story was Eugene bans neonic. So but a couple of thoughts looking back over the 10 or 15 years we've been working on this. No step too small. We started our pesticide-free parks program with a park, and then 2 parks, and then 6 parks. So we started with ones we knew we could win on, and that actually kind of got a foot in the door. We started with an IPM program that wasn't perfect, and we perfected it. Just kept working on it. So I think it was a kind of a collaboration between us, the people in the community, and the activists that kind of got us here. So say don't lose heart, and don't be afraid to start really small. So go after your councils. Okay? Thank you.
Do you have to take off? He's got to take off. If they know how to contact you, though, right?
Through the NCAP link into this event.
Okay. Do you want to tell them, or your email address, or if anyone wants his phone number, he has to take off right away?
So I can be reached at jonathanwild@hotmail.com. JONATHANWILD@hotmail.com. Would be glad to answer any of your questions at that point. Sorry, I have to leave early.
Thank you so
Thank you.
much. Thank you. No, that was really a great presentation, all of you. So, we're all like a little family here. It's not going to be hard to communicate. So, why don't we start here?
Matt, in your hospital program, do you cover biological controls in the hospital at all? Because chlorine and fungicides are very toxic.
Right. We, at this point of our project, it's particularly focused just on the pest control side of things for mostly just the pests I pointed out. So it's mostly looking at alternatives to just mostly at prevention measures. So it's most of the things I focus on is the entry points, the food that the pests are eating, and then we have mostly recommended boric acid in a gel form, basically, as a least toxic pesticide, and that's kind of where the recommendations that I've made.
You don't do anything with the cleaning products?
Right. No. At this point of the project, it's really just on the working between and coordinating between the pest control company and what they work on between the staff of the hospital that works with the pest control company. And so focus really just on the pests and what they're treated. So it's the pest control company is not looking at cleaning materials, for example. It's what we're kind of the second set of eyes for the pest control company and for the environmental services department and the facilities that works with the pest control company.
I think you had a question?
The issue of the issue of neonics and nursery plants. We've heard a number of times in the last day that just getting nursery plants for homeowners as well as for municipalities to they aren't sprayed is difficult and challenging. And it seems like there's a number of avenues to maybe address that. There's policy issues, there's education, but I'm wondering about incentives. I'm sort of thinking about the Purge the Spurge event, and you're giving incentives to homeowners around invasive weeds. Are there any thoughts about ways to do incentives for nurseries to grow and develop sales programs that are neonic free?
Yeah, the Beyond Pesticides has their Be Safe. Is it Be Safe? Is that what it's called?
Be protective.
Be Protective, the Be Protective program. And we were thinking that it would be a good idea, to potentially have Beyond Pesticides. They're Beyond Pesticides and some of the other groups that are doing these bee programs, get involved in this. So this one nursery that's willing to work with us, and we should be promoting that. We should, instead of slapping people down, what you need to do is have people have maybe labels that go on plants to say, so when you go to buy a plant, this plant hasn't been treated. And eventually people won't buy them if they don't have that label. That's one of the things that we're considering at the city. The director in my department said we need to get into the stores and start educating them, and you can't ask them to do things that even signage is against the law in Colorado according to the state pesticide law. We couldn't require that in the city. So you have to, the idea you have of having incentives is really a good one, and we'll be exploring that more.
And what's the nursery?
I cannot remember their name. One of the other employees has been working on, calling all of them, and she's sourcing them from different places. But, we need to make sure that we let people know what that list of nurseries are. I think this is a wholesale one, probably.
Well, as one of your citizens, I just wanted to ask.
Yeah, thanks.
Can I make a comment on that?
Uh-huh.
There's a group in Portland called Bee Friendly Portland that's been organizing events called carrot mobs. That refers to the idea of sticks and carrots instead of doing a boycott of rewarding them. And so the carrot mob is a party that they have at the garden center. They started with one in the fall, they're having another, and they're trying to spread it. But when the garden center stops selling the neonics on their shelves and goes to all their vendors and talks with them, then they have this party and encourage people to spend their money there. So that's another thing that citizens can do to organize.
Before that you ask the question, I just want to add one more thing to what you said. You asked about the cleaning products, which are a little beyond the scope of what we're working on right now. But by educating the hospital about safer products in general, a lot of them have made safer other choices. One of the facilities is a scent-free facility now. Another one's working more on landscaping and outdoor space. One of them is putting pressure, affiliated with a school, and eventually going to put pressure on the school to join to work with them on being pesticide free. And another one puts their influence over offices that are on their campus. So those offices that they rent to other doctors or other healthcare providers are also using safer products or practicing IPM and not using pesticides, or having safer sanitation practices within their own areas to make. So the hospital basically has influence over other areas around them, and we hopefully, as they get educated, they put pressure on other organizations, businesses, and schools to make safer choices as well.
This is just kind of futuristic question, and I expect the answer to be, I don't know. But do any of you know of like a pesticide management company that's using IPM practices so that, I can use that as an example when I talk to people?
Yeah, there's a number of companies that have been certified IPM Star or certified through Oregon Tilth or OSU to have integrated pest management policies and staff that are trained in that.
So that's in Oregon, or is it national chains?
Well, may I add, they're pest control companies. Almost, I'm going to get bet that the vast majority of them say they have IPM practices and procedures in place, but many of them are not a high level of integrated pest management. And one of the problems with that word is that there's many definitions of it, and the pest control company's definition may not be what we want it to be. And so we always have to remember, if you're hiring a pest control company, or you know of a company that's hiring a pest control company, that they are the client and they have to do what the customer wants. And if they claim they do IPM, it's making sure that in their contract is language that specifically says what you want them to, how you want them to practice IPM. And like I said, what I do is reviewing logs and making sure that they're practicing it correctly. An IPM coordinator position at anyone that's hiring a pest control company should be able to review logs and review what's being used, review that they're making the appropriate recommendations, so prevention is focused on, and non-chemical solutions are done first, and then they have and use least toxics as a last resort. There are companies that we have that we work with that do practice a high level of integrated pest management, and some have framed their program to be able to work with some of the hospitals that we have worked with. So there are some success stories, but making sure that it's not just because they say they practice IPM doesn't always mean that they do.
But for structural pests, they go in and they do the scouting and they fill cracks and do that type of work. That's work for them too. And a lot of them are under contract with schools or whatever. So, I know in Colorado that the Pest Management Association's supportive of IPM in schools. They don't particularly want to be out there spraying chemicals, and so if they can find, work doing the other things, that still requires, constant vigilance. So, you ask for it, and a lot of them will start, a lot of it's consumer demand.
I think she was actually interested in what you were talking about. Do you have anything more to say about that? Certification for IPM for landscape.
That's what I was hoping to speak about, is the IPM registered people might have some kind of certificate from one or the other group or groups.
Yeah, typically there's an extension office in each state. So Oregon State University has an extension, Washington State University, and they, in each of those universities, they have systems set up to train and certify facility users and to be certified in IPM practices.
Certified from the school?
Yes.
Okay.
From the extension.
And IPM's Institute of North America has a certification system.
I have one more question also. So if I can try to keep my points together, because I'm going to look at all of you guys here, websites and everything. I'm prepared. For those of us selling chemicals in the nursery business per se, we've got some organic ideas, oils, pyrethrins instead of the permethrin from the chrysanthemum, right, and DE. So I haven't heard a lot about what you guys are using. I just hear go look at what we're doing. Is there a specific thing that seems to work the best for most of these pests when you do have to use a not such evasive pesticide?
Are you you're talking about outdoor areas, landscapes?
Whatever to kill a
Nursery?
bug. Is there something that
Well,
works best?
one of the things that we try to do, I can talk for Boulder, and then Kevin can tell you what they do in Eugene. But we try to get completely away from the whole product mindset, because when you try to just hit one little problem with an immediate black-white answer, and you don't look at the complexity of the situation, you're set up for failure. You fail with synthetic pesticides, or insects become resistant over time, or have health impacts on workers, or non-targeted organisms. And even with organic products, if you try to just switch from a conventional to an organic replacement, it's not very effective. And I don't know very many cases where it is. So what we try to do, turf is a perfect example. Completely get away from the product mindset and create the soil, the healthy soil that can support healthy plant growth. Now, greenhouses are a totally different animal, and if you talk to Chip Osborne, if you grab him, he used to be in the greenhouse business, and I know that when he transitioned over from conventional organic, that he had methods that he could talk to you about, but there are organic nurseries.
Thank you.
Do you have anything to add?
Yeah, no, I would just say that I would acknowledge the challenges for that'll be faced by folks that are not working in a sort of an in-ground system. When you're trying to grow in pots or you're trying to grow in a greenhouse setting, it's very challenging. So it's easy enough. I think we have some approaches that work because we're growing in the ground and we actually can feed the soil, but when you're working in a sort of a more artificial soil situation, that can be very challenging. So I think Chip would be a great resource for you. Good luck.
He has been.
Great.
Good. And then, you know, the other thing I think that consumers need to educate themselves about, if you see like a really bushy, flowery plant from a greenhouse, you know, it's probably been treated. You know, the plants that we've bought that are organic plants are more spindly and, you know, not as you know, aesthetically appealing in the pot. You know, I'm sure once you get them planted, you know, they do just fine. But, you know, that's something that consumers need to question is, you know, when you want a certain aesthetic, you know, in an artificial aesthetic, it's difficult to get that without chemicals.
So you mentioned insects, like in the case of bed bugs, they'll use traps. You can just put up a simple, it's like a little cup that you put underneath each bedpost, and then you'll trap bed bugs that way, and that kills them without chemicals. But then in the case where you have to use chemicals, then it's more important how you're using them. So you're not spraying everything, you're not setting off a bomb. Maybe you would use localized application or even painting on pesticides in some cases for
Well,
like.
I'm just dying to know because I've been doing this, but diatomaceous earth seems to be something that I've been turned on to. And I don't know if I'm doing the right thing, but it seems that it works and doesn't really harm people. But I'm afraid I'm killing good bugs too, perhaps. Yeah.
Yeah, so it's important to match the treatment with the pest. And so knowing what infestation you have, or if you have a certain kind of insect that you're trying to get rid of, you have to match the solution with the pest.
Seems to kill everything.
It does, yeah.
Yeah, and a lot of it's just trial and error, you know, finding out what works for you in your system.
Like cornmeal gluten works well in certain cases or in low moisture areas, but we haven't found it to work as well here. You have to put it out a certain time here, so there's a lot of trial and error. We have something called the SPIN, Sustainable Places Information Network, and that has a lot of information peer-to-peer. So,
NCAP,
yes.
which is where I'm excited to find out more about all
Okay,
this.
good. That has a lot of different park user or park managers who put information up of what's worked for them, and then you can match it to your locality.
So I have a question about the neonicotinoids. When we ban things, we usually don't think about what's going to be used instead. So did you find that with the city of Eugene that this was a good opportunity for education as opposed to, I know that the next chemical or, a chemical that you would choose other than neonic isn't a great choice either. And it sounded like the people that had the big flower baskets were doing something that, just in general with any chemical, wasn't a good idea. So what I heard you say is they banned neonics and then they said yes to IPM throughout all city departments.
Yes.
So it was
Yes.
kind of a 1-2 punch. Do you think that they had to ban neonics after, wouldn't IPM have done that ultimately if you were doing that correctly?
In my opinion, yes. Right, if they were doing it correctly. There was a part of your question that I'm hoping this is what you're asking because I would love to say something about that. And it's the piece about the aesthetic piece. You sort of asked, I think we got to, well, what are they going to replace it with? One of the things that I really appreciate about the conversation we ended up having was, do we really need hanging baskets? What if we used, it's that challenge that we talked about just a minute ago with, you have this artificial environment. You put all these plants out in this heat island and bake them with the sun, and of course all the pests just flock to them. So we really were able to have a conversation about, is that really what we're going to do? Should we hang up colored banners instead? What are the options? And also changing the plants out totally. So to answer your question more directly, there wasn't a direct switch over. The approach was from spraying with neonicotinoids. My understanding is what they're doing is they're trying some organic pesticides, and they're also changing out the plants totally, so they won't look the same. But I think that's really where I can get kind of excited about that line of thinking, and it gets to the aesthetic piece. Are we going to change what our expectations are when we see those giant flower baskets in that sort of setting, and they look so perfect? Are we thinking that that's a healthy thing, or are we recognizing that it's not? So I appreciate your question. Did I answer what was actually your question? Okay, good. That's a great question, because it's often a trade-off, and it's not necessarily a good one.
You know, and there are situations where, you know, like normally you wouldn't use a product ever, and then you have an emergency or an emerging pest where, you know, that can turn a city with policies like ours upside down.
Mm-hmm.
And an example is emerald ash borer, you know, that kills every ash tree that it infests without chemical treatment. So when you have a, you know, when we talk about, you know, people oversimplifying issues, you know, on the other side, you know, where people want to use pesticides routinely, I feel like it's really important that all of us don't oversimplify the other thing and say, oh, well, you just don't use anything, or, you know, there's all these trade-offs involved, you know, environmental benefits, you know, that go both ways. So you have to do this messy, you know, balancing act and try to figure out what's the best, you know, balancing all your different impacts. What are you going to do? You know, what choices and options do you have? And I think going into that uncomfortable zone, you come up with better solutions, you know, because you start trying different things.
Well, it does seem, pesticides are really toxic, so it does seem that if we can get them, you know, fewer of them in the hands of just the public, and that the people who really play with them have more education. I heard this morning's speaker talk about, you know, one of the chemicals used for rat poison, and how there was no anecdote for you know, another chemical used instead of, and so that's a problem, because, you know, if you poisoned, now we can't save you. So, I mean, there are a lot of complications that,
Right.
you know, and those are chemicals that people use, you know.
Right, and you know, and there are companies right now. The EPA is trying to take certain formulations off the market, and the company is, you know, the companies are just dragging their feet. The EPA is not taking swift action, and when is it California's trying to ban them, that they were sued by the companies. You know, so consumers have to educate themselves about what they're buying, and just don't assume because something's on the shelf that it's safe for you or your kids.
To start with your local, like you said in the yellow shirt, your local, start small.
Yep.
I have a question. Hello. 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 All right. Anyhow, the question is, have you had any help or ability to work with the big companies like the Walmarts, Costco's, I don't know the names of all these companies, that sell plants in big bulk, that are raised in other places, and an ability to get rid of the neonics in those plants, or just not offering in your community wild plants that would become wild impossibilities, the broom and that kind of thing. Any help in working in those areas?
You know, a group, is Susan Kegley still here? Susan Kegley and was it Environmental Defense Fund? One of the nonprofits went out and randomly took plants from Home Depot and Lowe's and tested them.
Friends of the Earth.
Friends of the Earth, yeah, Friends of the Earth. And, you know, found that a significant number of them had measurable levels. And then they said that the pollinator panel this morning, I just saw the tail end of it, that Home Depot's starting to respond and change, you know, some of the products that they're starting to provide to people. So that's where it all starts. You know, you can't necessarily change government regulation or how it's enforced, but you can change where you spend your money and what you buy, and start asking questions. And when enough people ask the right questions, then things will change.
Yeah, that gets back to the carrot and the stick. So in this case, I would say for retailers, you would need a corporate campaign and a stick where everyone is writing Lowe's and Home Depot and asking them to no longer carry it. And then NCAP's response is of supporting a federal policy, the Save the American Pollinators Act, to put a moratorium on the neonics. And
Are there any other questions?
Well, I just want
My
to add,
sidekick.
with the study that you mentioned with the Friends of the Earth, they're going to be releasing another one. They're doing a second round of testing of plants to see if anything's improved from the last time that they released that report, which is, I think, about 8 months ago now.
Yeah, it was last
And
year.
so they're in the process of doing that now. And Friends of the Earth is running a corporate campaign right now with a whole host of nonprofits including Beyond Pesticides and NCAP and Beyond Toxics. Many groups are involved in that to get Home Depot and Lowe's to change their practices.
So we just have maybe about 10 minutes left. I don't know, how many people here are from Oregon? Other cities? Are you from? Albuquerque. Wow, Albuquerque. Where are you from?
Olympia, Washington.
Okay, Washington. Can I ask?
I already said I'm from Oregon.
Oh, I'm sorry.
That's
I
all
didn't
right.
see
No,
you.
that's okay.
Davis, California.
Okay. Okay, great. Eugene. Okay. Well, the reason I'm asked, and where are you from? California. Okay. The reason I asked is even, whether the individuals here on our panel today are from, wherever, it doesn't mean that you can't contact them for assistance or advice on how you'd like to proceed in, working on policies and programs in your own city. So but what I'd like to do just for the very end is, if you have you've told wonderful anecdotes and stories, and one of the things I always like to remind people of is that allies can come from very unexpected places. And so don't ever forget about that when you're working on your programs. Did you have something you wanted to say?
Yeah, I'd like to, make a request. Sure. This is my first Beyond Pesticide workshop, and I'm really impressed on the diversity of the presentations. Very appreciative about the amount of information and the information I've gotten from individuals. What I'd like to see happen that I would think would be helpful for somebody like me is like, okay, you guys are giving out your cards all the time and people may be contacting you. So like, I'm going to be working with a city council person to develop something. It would be great if you guys could like share it. Now when I email you, it's like, okay, I'm the person that's interested in yada yada. Is there anybody else doing it close by me, or somebody that's at the same entry level as me? So it's like that two-person thing. So it's like you got somebody to collaborate with, even if you're not in the same town. So that would be something I'd like to see in the future, or if you're already developing it, share that.
I was actually 5 years ago. So I worked with my Parks Board and City Council and the Parks Department to ask the City of Everett to no longer spray pesticides at our park. And I contacted NCAP, and they sent out, they used my zip code, and we have, all of our members in a website or in a database, and they sent out a information request or sent out a thing asking other people in the area if they could come and support it. And NCAP wrote a letter to City of Everett in support of the program, so we do offer that, and I'll answer your email.
And what's really wonderful about Beyond Pesticides is they've been filming today with this great crew. Thank you
yeah.
for everything. And these videos and presentations are going to be available online. I can't tell you precisely when, but they will be, and that's an opportunity for you to be able to share this information broadly with folks that are, near you and close to you. So are there some final words from everyone before, maybe starting with Matt, that you'd just like to say before we conclude?
Well, I guess the final words, I guess everyone could repeat this too, but everything we've talked about and I feel can be replicated anywhere in the country. I feel any hospital can eliminate pesticide usage and prevent pests, and it's if you have connections to a hospital, I think the first step is making sure that they understand the risks associated with a lot of these pesticides and how easy proper IPM implementation can be. So it's the first step is just to understand what they can do to prevent pests, and then the use of these pesticides will be unnecessary.
I have no idea what to say. I guess it's just important to find the networks and find other people and figure out who else is working on this and other ways you can collaborate, things you can do. There's a lot of different people out there, a lot of issues, and everyone is busy. So yeah, find other people.
Yeah, I would kind of go the same direction. Looking for people to collaborate with, sort of like minds. I'm really intrigued by the carrot mob thought. I think there's a lot to be said for helping people, for being positive about how we push for change. And I think one of the things that's worked very well for us in our programs with working with NCAP staff is one of the powerful things that they've done is develop alternative approaches. So they hand us tools and we help, and we get to develop tools together. So I think to the extent that you can help people do that, you can actually make the change easier. Can we help someone find a source for another product? Can we organize people? So I think thinking about it positively and offering tools is a great way to make change easier for others.
And when we're working, at the city level, we always have like a million projects and a lot of things going on. I still try to talk to the other cities and counties and get ideas about what they're doing, but don't have enough time for public outreach, which is, a real problem. I'm trying to carve out more time as I go. But, the thing that you guys are doing with your gardens, that is so important. There's a study, I think it happened, I think it was in Washington State, where they talked about when you have these neighborhoods where people start doing new practices and they educate their own neighbors, that's so much more effective than someone like Kevin and me coming in and saying, you should stop using these pesticides and try to tell people what to do in our positions. So, I think partnering with neighborhood groups and then you having, the cities or whatever, other partners or nonprofits, all of us working together, promoting these things is really important. And so, one of the reasons I went on the tour was to see how you guys were doing that, because that's something we like to replicate too.
Pretty exciting.
So I just want to say thank you to, I grew up in Portland, and I haven't been back in 20 years. And so much has changed, but it's such a beautiful city that I realized I don't think I appreciated it as much as I should have. But I really have enjoyed this tremendous panel. There's so much that you're offering everyone, and your generosity and your ability to articulate it is really so fantastic. And just thank you, everyone, for coming today and joining us. And bless you. And we have the best seats in the house for dinner, which is good.
All right.